I'm Jason Pritchard, and I'm the Recovery Program Manager for Ballad Health. And I cover, I oversee or manage the program PEERHelp, which stands for Programming, Education, Employment, Recovery Help. The program spans 21 counties in 2 states. I'll let you go ahead and go to the next slide. So, Ballad Health's Peer Help program, it was created in October of 2019 from a 12-month planning grant from HRSA, which is the Health Resource and Service Administration. And that program, that grant, when I came there, actually only 9.5 months was left remaining. So I'd left a job and stepped out in faith. Um, and currently, the program consists of 6 certified peer recovery specialists with a total incarceration time of 20 plus years. And again, Peer Help serves 21 counties in 2 states. But I want to stop right here and back up just a little bit. So, I'm a person in long term recovery, and I spent 16 years in active addiction. I'm now 9 years in recovery. I was incarcerated on 3 different occasions, and the last incarceration was from 2012 to 2017. I was sentenced to 6 years and served 5. And so when I came home, I had received a certification from the Department of Labor called Commercial Foods Management. And I came home and started working as a cook for Olive Garden, and soon started moving up. I became a certified trainer, which was called a CT, and I would train other cooks. And I worked that job for about 19 months. And I began to step out and interview. I was looking initially for manager jobs because I'd already convinced myself that despite having a bachelor's degree in finance from Virginia Tech, I had pretty much, because of my substance use and incarceration history, there was really no other opportunities for me or things to pursue. I just had to humble myself and be glad that at least I could find some work. Um, but on in November, yeah, around October or November of 2018, I had started interviewing for kitchen manager jobs. And then one day, a lady who worked for Highlands Community Services sent me an application or a job snippet talking about working as a peer recovery person for Ballad Health, or they were looking for a person with lived experience. But at the time, their definition of lived experience was someone that had a clinical background that had been serving those individuals who had suffered from mental health or substance use disorders. And so I came and interviewed for the job, and I'll never forget, I brought this binder that had all the certificates that I had received, and I had been working on a reentry plan. And when I came home, I'd put it into like started working it myself. I'm trying to into action. So I'd put the program into action, and it had shown its own success through my success. And so I'm sitting down, and I'll never forget, I'm explaining all this, and my now my director, she's looking at it, and you can just see the atmosphere is like so good, like I know I'm doing really good in the interview. And then she says, well, where did you get all this? And I'm like, oh, I got it while I was in prison. And like immediately you could feel like just a change, like in the atmosphere. And so now we kind of sit back and laugh about it, but at the time it was really serious, like because I was loving the opportunity and was really hopeful that they would see past the substance use background and the felonies. But I did bring a new perspective to Ballad of what lived experience was. And so now we fast forward, I end up getting the job, but it was a hard fought battle. And I have to give my director credit. She really went to bat for me with HR, but they finally get it approved. And so I go to work, and we start off on a planning grant. We do 17 focus groups across Northeast Tennessee and Southwest Virginia, and we engage the public as to what things could better help individuals who are suffering from substance use disorder. And 3 primary topics come up: a centralized navigation hub for resources. So in a lot of cases, resources do exist, but the community or the people who are pursuing the resources don't know that they exist. So I would be sitting in rooms at times where people would say, "Hey, what I really need is this, this, and this, A, B, and C resource." And I'm sitting there and I'm like, "Well, that person over there provides that resource, and that person over there," but they just didn't know of each other. Like the person that had the resource was, in a lot of cases, having trouble identifying consumers of the resource, and then the consumers of the resource had trouble finding the resource itself. And so when we wrote to HRSA, we put in there that we would like to create a centralized navigation hub and reentry service that would be set up and manned by certified peer recovery specialists that would be certified in 2 states. Okay, so now we can go to the next slide. So PEERHelp was born. We applied for a $1 million HRSA grant after the planning phase, and we were awarded. And that grant has created PEERHelp. PEERHelp's mission is that it seeks to improve the quality of life for individuals in treatment and recovery from substance use disorder by addressing their health-related social needs through tailored social support, resource navigation, and advocacy. Our vision is that PEERHelp envisions that all people returning from incarceration or treatment from substance use disorder will have a seamless reentry into society by having the necessary resources and opportunities to succeed, therefore reducing the morbidity and mortality of substance use disorder and recidivism in the Appalachian Highlands. So we really just have a heart, like everyone that's on this team from the top down has been affected in some form or fashion by addiction, incarceration, or mental health. So I want to talk a little bit about the success of the program. So moving forward, we're going to be talking about the things that PEERHelp has accomplished. And I want to keep one thing in mind, that PEERHelp was not in existence prior to October of 2019. So everything I'm about to share with you has been done despite the COVID pandemic. So while I have seen some organizations and things that have been affected in negative capacity, we have exceeded, we've been flexible, we've been outside the box, and as you're about to see, depending on your definition of success, we have been successful. So since October of 2019, we've conducted 11 Narcan trainings, and 94 individuals have been trained and provided Narcan. We have conducted 3 certified peer recovery specialist trainings that have trained 39 peers in Southwest Virginia and Northeast Tennessee. We have another upcoming training scheduled for May 17th. And to give you an idea, like when I was trained in January of 2019 to become a peer recovery specialist, I was trained in Virginia. It cost me $3,800. I had to leave the area for 10 days. We didn't have a local trainer. So we have went out and pursued through advocacy and now have trainers on staff. And we offer the trainings typically for free unless we're working through community partners who have money to pay for their participants to be trained. And so it's just really awesome. And we had done research, and in our area for East Tennessee and Southwest Virginia. In Southwest Virginia, we only had 2.7% of the state's certified peer recovery specialists. And on Tennessee side, it was a little bit higher. It was like 5.9%. But you can see our rural counties, which we know is the case, was tremendously underserved when you look at peer support services. And so we set about to change that. And the thing that we've come up with is that we certify our peer recovery specialists in both states. So they become dual state certified, and we elevate the number of peer recovery specialists in both service areas, Virginia and Tennessee. We've also have on staff trainers that have been certified through a virtual peer support system on how to train peer recovery specialists on how to use digital platforms. So we all know when COVID hit, a lot of people didn't even know what Zoom was. They didn't know what WebEx was. And so Dartmouth University had developed a training in conjunction with a group of peers out of New Hampshire. And so they had come together and created this virtual peer support training. And we have now trained 3 of those trainings for a total of 82 individuals, 7 of who were incarcerated. And when we were teaching them about how to use digital platforms in order to obtain peer services post-release. We currently recovery support facilitator certifications. So this is things that our staff, our peer recovery specialists are certified and either they are able to offer or are currently offering. Currently, we have 8 community meetings and 2 jail meetings. We're hoping by the middle of July to have that expanded to 14 community meetings and 4 jail meetings. Our Tennessee jails are starting to open back up where we can do in-person stuff. So we're certified in smart recovery, and we have 21 peer recovery specialists who have been certified as smart recovery facilitators. We have 6 peers currently enrolled in smart recovery certification, and we currently offer community programs on behalf of Frontier Health to Willow Ridge, Magnolia Ridge, and the Crisis Stabilization Unit. We also offer Living Free faith-based recovery. We have 16 peer recovery specialists we've certified as Living Free recovery facilitators. We're currently offering Living Free in the Abingdon jail to 11 individuals, and we have 4 community-based Living Free meetings that meet various times in the week. We also now are certified to offer moral recognition therapy, better known as MRT. And we're currently offering MRT in the Johnson County, Tennessee jail on behalf of the Action Coalition. Okay, we can go to the next slide. We are also have a resource called Pathways to Recovery. That's a huge resource. It's self-exploration, self-help workbook. It's about 300 pages, and it's really admired and promoted through the Virginia Peer Network. And we currently have a class that meets on Thursdays from 9:30 to 10:30. We also were recently certified in a workforce skills program, and we've sought out a soft skills. So we're going to be putting together a curriculum for people who are in recovery that presents workforce skills and soft skills from the view of the employer, but to address the employee. So we're going to be training employees on how to view things from the employer's perspective related to workforce skills and soft skills. And it's things like, for instance, social media. Like we know in today's time, social media has been a nightmare and a blessing at the same time for some organizations. And so this platform or this curriculum teaches employees that once you put something out on social media, it's out there. Even if you delete it, a good IT person can go and find it. And so we're really excited about that, and we'll be turning that resource community facing as well. We want to do a couple of in-house trainings just to get comfortable training the software, but I mean the curriculum, but it's really awesome. We also created a PEERHelp warm line, and its operations began June 26th of 2020. We've had 128 phone calls to date. 72 have been substance use disorder resource navigation related. 23 have been mental health need related. 17 were individuals seeking social needs for themselves, food, housing, clothing, rental assistance, and 14 have had co-occurring needs. Since the utilization has increased 25% in the last month, and this continued growth will occur as we have signed multiple community partner MOUs who have agreed to utilize and refer their clients to the PEERHelp hotline for peer support services. We have also begun to receive individuals utilizing Warmline after incarceration. So our numbers are continuing to grow. We have Reentry Navigation services. So they're more tailored to second chance employment. And we currently have pilot sites that are active in Duffield, Virginia, Duffield Regional Jail in Scott County, Virginia. And we have 8 active cases. 2 of those currently released from incarceration. We also have pending about 15 more intakes over the next 60 days. We were just recognized in Wise County, Virginia, Judicial District 18 as an alternative sentencing program. So we have taken our recovery meetings and coupled them with our business skills and soft skills. And starting May 1st, people in Wise County, Virginia, who have been sentenced to second and third drug offenses or probation violations carrying greater than 12 months will be able to participate in the PEERHelp program versus going to jail or prison. So we're really excited about that. We also have pilot sites active in Greene County Detention Center and Johnson County Jail. Both of those currently have 7 participants each, but both also have a list in the coming week to be bringing in another 10 to 15 participants as well. We have an email, we offer PEERHelp email navigation services, and this is something that's really unique about our program, is that we sought out a federal funder to fund a jail email account. Currently, it's active across all of Southwest Virginia, and it's moving towards 3 additional Tennessee counties. Some of the Tennessee counties did not have access to email for incarcerated individuals. That's something that we plan to begin advocacy for to get those services available. We're able to pay for the person that's incarcerated to email us and receive emails from us. So we're really excited about that. And we've seen to date, we've served 125 individuals. Last week, we received 20 new emails. That's not counting emails that's already in process. We're just talking about new participants that we had never received. We received 20 last week. And we started off receiving 3 a week. So it's grown like in just a few months. It's grown so much. Okay, next slide, please. And so this whole platform was created for of course it was to be a service, but underneath there was another issue that had been identified. So in Virginia, you have to have 500 contact hours to be certified as a peer recovery specialist. And the problem is that if you are an organization that is licensed or certified by DBHDS, you have barrier crimes, for instance, distribution, possession, manufacturing, and then it goes on and on. Even a simple assault. If you have a simple assault and a DUI, that's barrier crimes. So you have individuals that wanted to be peer recovery specialists, but most of the organizations that hired peer recovery specialists were certified and licensed by DBHDS, and you couldn't even go volunteer there to get your 500 hours. So our thought was, we'll create this PEERHelp program, and then when we train the peer recovery specialists, we'll let them volunteer. They'll help us do our recovery meetings. They'll answer our peer warm line calls. They'll respond to our jail emails. That's going to expand our capacity so we can continue growing at low cost, and at the same time, it'll be providing an opportunity for those individuals to receive their certification. And the reason we did is because in 2019, a study was conducted by Virginia Commonwealth University at the request of the Virginia Department of Behavioral Health Services. And the study was addressing why the number of trained peer specialists was increasing, but the number of certified peers wasn't increasing at the same rate. And the 500 hours was the problem. We currently have 25 volunteers enrolled in our PEERHelp program, and we have another training scheduled on May 17th. PEERHelp has signed MOUs with the Southwest Virginia Workforce Development Board, which covers 7 of the 11 Virginia counties. We also signed agreements with Mount Rogers, New River Valley, which covers our other 4 counties. We have signed agreements with Action Coalition, Bristol Redevelopment Housing Authority, Destiny's Outreach Ministry, Emory and Henry College, and we also have received commitments from Savita Health and Revita Recovery. And what this is we received 4 foundation money to set up volunteer sites. So we bought computer software, computers, printers, headsets, all these things, and we set them up for the volunteers to be able to come. So what's the benefit of this? The benefit is not only does the individual get to do their 500 hours, Ballad continues to grow the PEERHelp program and expand its capacity, and the community partner gets access to a peer recovery specialist in-house at no cost to the community partner. So we're sending free peer services into these organizations that probably otherwise would not be able to provide or afford to hire a peer recovery specialist. And so it's just beneficial. I really see that this is something that's going to have longevity, and it's really starting to get traction and move forward. Okay, next slide. Our current program infrastructure is that we have a CPRS expansion plan. We have one person who is one in-person Virginia trainer on staff, also a virtual trainer, so we can train in person and virtual now. We have 2 DBHDS certified ethics trainers. We offer the dual state certification process. Tennessee has a reciprocity state to state, so we can train Virginia and then reciprocate that training into Tennessee. And currently, we have a peer that is a supervisor, is certified to supervise in both Tennessee and Virginia. We have the internship rotations. The PEERHelp warm line is hopefully in the future is going to be 24/7. Starting the end of May, it will be 16 hours a day. We have virtual peer recovery meetings, as I've already talked about. We have smart recovery, living free, self-exploration, MRT, and recovery pathways. We are hoping to expand into clinical expert screenings across 21 healthcare facilities. We have a DOC peer support program where we're providing peer support inside Department of Corrections. And we have the recovery community navigators. Currently, we have six on staff that are all serving at various pilot sites. We have the recovery community navigation hub. And we have a specified timeline for engagement, which so far is showing a lot of promise. The 6 navigators currently employed, 1 operates Duffield Regional Jail Site, 1 Greenville Detention Center in Tennessee, 1 in Johnson County, 1 just got hired on Monday and will be starting Sullivan County, Tennessee very soon. And then we have 1 that operates the jail emails and oversees all the volunteers in the PEERHelp warm line. Next slide, please. Our current funding streams, we have a $1 million 3-year RCORE implementation grant, which currently funds 3 recovery community navigators and limited CPRS expansion. We also have a $75,000 1-year grant awarded by the Foundation for Opioid Response Efforts, which is 4. These funds really was what expanded the PEERHelp warm line. It bought the technology devices to serve 30 volunteers and 4 correction facilities, and it provided facilitator training for 50 individuals in smart recovery and living free. We also have obtained 2 new contracts. One is a WORC contract, which was provided by First Tennessee Development District. It hired 2 peer recovery community navigators to serve Washington, Johnson, Carter, and Sullivan counties in Tennessee. And hopefully eventually it would serve the upper 8, but right now we're focusing on 4. We also received an ARC Power Grant contract from Mount Rogers New River Valley Workforce Development Board, which was right at $180,000 to train 72 peer recovery specialists over the next 3 years, which will continue to provide the necessary people to keep the PEERHelp warm line volunteer services going. So a little bit about the grant contracts. Our work contract with First Tennessee Development District, the 2 peer navigators serve the upper 8 Tennessee counties with navigation and second chance employment. And what they're doing is they're engaging individuals who are leaving incarceration or treatment and navigating them to caring workplaces, which is a recovery friendly employment initiative. So First Tennessee Development District is actually going and certifying businesses as recovery friendly workplaces. And then PEERHelp is engaged with the individuals who are coming out of incarceration and navigating them to the jobs that are being supplied by the recovery friendly businesses. And I know the question has to be, so why is this important? The reason it's important is because if we do research, one of the highest overdose rates is within 2 weeks of within 2 weeks of release from incarceration, if that individual has been sentenced to at least 6 months. So what we found is if a person can come out and have a purpose or find a reason to go, they don't tend to go back to the substance use. The substance use tends to be, well, we've heard the comment about idle hands is the devil's tools. So if a person has a purpose and something to move forward and a person there working with them, our hope is that the not only will the recidivism rate go down, but also the overdose rate for individuals being released from treatment incarceration. And then our Power Grant contract was funding to train 72 peer recovery specialists over the next 3 years. The funding covers training, supervision of the 500 hours. It also aids in the vision of peer expansion for the Ballad Health service area. So this is not just a shot in the dark. Like, this is something that's going to be around at least for the next 3 or 4 years, and hopefully moving forward it'll be seen as a real benefit not only to the community but to employers who would want to buy into its sustainability. And I think that concludes my presentation, but I would be glad to take any questions.
Hey, Jason.
Hey.
That's great. It's so impressive what all you guys are doing. So I'm with I know we know each other, but I'm with the Tennessee Department of Health, and I'm in a new position that's a substance misuse response coordinator. And Jason, I think you attended the workshop that we held back in the beginning of March, where we were trying to identify kind of what projects we could work on. Like I said, it's a new position, so we're just kind of getting started here, but just hearing everything you guys have done, that's amazing. And I think I could really pick your brain on some things, but I did have a few questions with the email access that you were talking about in the jails. Do you know if the Washington County Detention Center had the access to emails?
I do not know if they do, but I would assume that they would be big enough that they would have it. So I'm not sure about that, but
Okay.
I'll know very soon because that's one of the ones that we're going to target.
Okay. That was kind of another thought. The projects that we came up with after that workshop that we had identified were MAT navigation in the correctional setting, and naloxone access, and also a pretrial diversion program. And we decided the pretrial diversion is going to be in Sullivan, and then the correctional setting MAT navigation will be in Washington. So we're partnering with Inside Alliance. Do you all work with them at all?
Yeah, we've had some meetings with them, and kind of we're a little ahead of the curve. So we've kind of provided some insight as to like what we're doing. And we've offered, like, we can accept, like, I know they already have actually one of their peer recovery specialists that went through our training, Ben McCurry.
Okay.
And so, yeah, we have been having meetings with them and kind of sharing a little information.
Okay. Is there anything that the Department of Health with our grant funding could do to help expand what you're already doing? Is there anything you need or could think of?
Well, I will say one thing. There's a couple of things. So we're having, and I can send you a meeting invite if you would like to join. We're pulling together, I don't know if you heard what I was saying earlier. We're pulling together the United Ways of Southwest Virginia and Northeast Tennessee, and we want to find funds to pay. When a person comes out of incarceration, a lot of times they're interested in going into transitional housing, but like our only option is Oxford House. And the first week costs the individual $170. So it's $150 application basically, or administrative fee, and then $120 for their first week. So just to get them into the Oxford House for the first week is about $270. What we're trying to do is try to find money that we could provide maybe the first 3 weeks. We believe we could have them employed hopefully in 3 weeks. So you figure it's 120, it's 360, 460, $510 per person. So that's one thing that could definitely help. Also, Where we do have limited funds is providing our materials and our recovery classes. So they're in very high demand, but they're in such high demand that we're burning through all the materials that we have, and we can't keep enough money to keep them in stock. So copies of MRT books,
Okay.
they usually cost about $25 to $35 a piece, depending on what bulk you buy them in. So I would say that's the two
Yeah.
biggest things we need. We have $3,000 a year for the next 3 years for email funds. I don't know how, because I will say things in Virginia and Tennessee they're sometimes different. So I don't know what the demand is going to be until we get it up and running. But if it's anything like it is in Virginia, $3,000 may not cover it.
Yeah. Okay. Yeah, that would be great if you can send me that invite. And what I'll do is I'll take this back to my central office folks who tell me what I can and cannot spend the money on, and just run this by them and hopefully come to the meeting with some more information and ways that maybe we could partner together on this. I think that would be great. Just one more question that I had. Do you have any sort of assessment tool that you use to identify anyone who is incarcerated, about to be released, that want to participate in this program? Like, how do you identify them?
So we have a certain criteria. We do have a tool set that we're in the process. It's called the Carry Guides, that we're pursuing. It's kind of a self-assessment, but basically for us, if you have not had a in-house charge, the jail lingo is if you hadn't called a shot, if you hadn't got a shot in 6 months, if you have a history of substance use, and you're returning to one of the upper 8 Tennessee counties or Cock or Hamblin, then you can tend to be eligible for the program in some form or fashion. With our HRSA grant, they have to be returning to one of 6 counties, but with the First Tennessee development, they can be returning to any of the upper 8. So we really have ways that we can make referrals in amongst our own team.
Okay. Well, I think that's all the questions I could come up with right now.
Okay.
But yeah, I look forward to that meeting and talking more. But thank you. That was an awesome presentation. It's really impressive.
Yeah, it's like when we think about that this happened during COVID, that's when you're really like, wow.
Oh yeah, it is kind of mind blowing. You're definitely ahead of the curve.
Well, and Jason, I'm not surprised at all that they've accomplished all of this. So he is a force, and he gets things done, and it's his enthusiasm and his determined state, and just he doesn't take no for an answer. He finds a way to get things done, and that's obvious. You can see what all's been done. And I think my question, Jason, is around the peer recovery support specialists. How can they get more involved at the provider level with physicians and clinicians who are prescribing or who have patients that come to them that they're not sure what to do with them?
So let me make sure I understand. So what would the providers do if they had people that they wanted to get peer support for?
Yes. How can they get in touch, and how do they go about bringing that service to their practice?
Okay, so our PEERHelp warm line, so 2 things. If you're in the upper 8 counties of Northeast Tennessee or Cock or Hamblin, you can call 877-733-7457, and you can reach directly to the PEERHelp staff. If you're outside of those 10 counties in Tennessee, you can contact the Tennessee Red Line Initiative, and their phone number is 800-889-9789. And so that's really the 2 big resources that I know of. But honestly, my phone number is 276-739-8527. And if you have a person that's suffering from mental health or substance use disorders and you give me a call, in some form or fashion, I'll do my best to help. Like it might just be a matter of connecting to another resource, but I never want a person that could use help, not get help just because someone didn't know what to do. So I'm always available.
I think that's excellent. And I know a lot of ministries that I've worked with in the past are trying to help people reintegrate into the workforce with job skills trainings and things like that. And so I could see this being you being a great contact for them as well. So is that something you all are amenable to? Is working with ministries out there that are
Yes, absolutely. So there currently we're just making referrals from the incarceration, but this initiative, this Second Chance Employment Initiative, they are going to take referrals from the community. They're just trying to figure out what's the process going to be. Um, what does it need to come? Do they need to be referred to PEERHelp? Can the church itself just refer to the American Job Center? But that's a resource that's usually available in most Tennessee counties, especially in the Ballad Health Service area, is that the American Job Centers have second chance opportunities. And so if you're in an area and you want to work with a population that has justice involvement, whether it be probation or incarceration, you can reach out to your local American Job Center and find out who the caseworker is there.
great.